For this presentation, I chose to talk about different moral codes that healthcare professionals abide by. I chose the ethical codes of nursing and how these codes get used. While there is not one specific ethical code for all branches of healthcare, the core principles of each are the same. Ethics within healthcare are important because workers must recognize healthcare dilemmas, make good judgments and decisions based on their values, while keeping within the laws that govern them. So let's look at values. Values are personal principles and ideas that help establish judgment between right and wrong. Morals are the actual beliefs that form a person's core values, rules that govern behavior. Ethics are the moral principles that direct a person's behavior, how people apply their morals. Ethical values are the universal rules of conduct that provide a practical basis for identifying what kinds of actions, intentions, and motives are valued. What are the codes of ethics and where did they come from? The original Code of Ethics was created in 1893 when Florence Nightingale, the founder of many of the principles of modern nursing, created the Nightingale Oath. It is a pledge all nurses take before entering their profession and highlights the moral and ethical guidelines they are expected to uphold. The code was developed as a guide for carrying out nursing responsibilities in a manner consistent with quality in nursing care and the ethical obligations of the profession. In 1950, the American Nurses Association, ANA, Center for Ethics and Human Rights established the Code of Ethics to help nurses navigate ethical and value conflicts and life and death decisions, many of which are common to everyday practice. In 2015, provisions were made to these codes to help guide the nursing practice in a more definitive way. The codes of ethics are based on many ethical principles. Here are the main four. Autonomy. Autonomy refers to a person's rational capacity for self-governance or self-determination, the ability to direct one's own life and choose for oneself. Autonomous patients have the freedom to make their own decisions without external influence. The patient should be allowed to exercise their capacity for self-determination. Examples of nurses demonstrating this include obtaining informed consent from the patient for treatment, accepting the situation when a patient refuses a medication, treatment, surgery, or other medical interventions. Non-maleficence. Non-maleficence is the principle that asks us not to inflict harm intentionally or unintentionally on others. We should not cause unnecessary injury or harm to those in our care. An example is avoiding negligent care of a patient. Beneficence says that we should do good to others. Beneficence enjoins us to advance the welfare of others and prevent or remove harm to them. This ethical principle encompasses charity and kindness, which require actions by the nurse to benefit others. An example could be a nurse holding a dying patient's hand or providing medication in a timely manner. Justice refers to people getting what is fair or what is due. Justice is fairness and impartiality. For example, if a nurse is responsible for the care of multiple patients, they would not provide better care based on who has the best insurance. Nursing principles in action. Obtaining informed consent. Informed consent states that patients be allowed to freely consent or to decline treatments, and that they receive the information they need to make informed judgments about them before care is administered. Nurses are responsible to educate a patient about the risks, benefits, and alternatives of a given procedure or intervention. Ethically, consent is about patient autonomy. Patient declines treatment such as insulin, refusal of chemotherapy. A nurse must respect the patient's decision, respecting autonomy. A patient's autonomy can be violated. Examples would be when family members or members of a healthcare team pressure a patient, or when they act on the patient's behalf without the patient's permission in a non-emergency situation. Another example would be a nurse not giving the patient all of the information needed to decide about the treatment options. Patient autonomy can be challenged. It can be challenged in many ways, leaving the patient unable to make decisions in their own best interests. Some examples are if a patient is under acute distress or in immense pain, patients who suffer from dementia, patients who suffer from drug addiction or alcoholism. Similarly, a person with a serious psychiatric illness or severe mental impairment are also susceptible to have their autonomy challenged. Infants and children are not fully autonomous, and the sorts of questions are forced on parents, guardians, and healthcare professionals. Which brings us into paternalism. Who decides? Paternalism is the overriding of a person's actions or decisions making for her own good. The doctor is choosing a course of action in the patient's best interest, but without the patient's consent. This can extend to nursing practice when nurses must persuade patients to follow the doctor's orders, or on the other hand, the nurse can advocate for their patients by helping them express their thoughts and concerns to the doctors. The Code of Ethics Provisions, revised in 2015. Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Nurses must demonstrate an understanding of competence and respect for patients, allowing them to feel valued and to grow, develop, trust, and value others. Nurses must recognize patients' rights, especially the right of self-determination or autonomy. The nurse must have compassion and respect for others to all the people they interact with within the workplace. Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. The nurse's commitment to the patient should remain steadfast when conflict occurs or persists. Nurses must recognize and maintain appropriate boundaries within relationships. If the professional boundaries are jeopardized, it is the nurse's responsibility to seek guidance from supervisors and/or take steps to remove themselves from the situation. Nurses should actively promote, collaborate, multidisciplinary planning to ensure the availability and accessibility of high-quality healthcare services to everyone in need. Provision 3. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. The nurse must protect the patient's rights to privacy and maintain the confidentiality of all patient information. The patient's right to self-determination includes the right to choose whether to participate in any type of research. If a nurse feels any research is morally questionable, it is her duty to question and, if necessary, refuse to participate in the research. Provision 4. The nurse has authority, accountability, and responsibility for nursing practice, makes decisions and takes actions consistent with the obligation to promote health and to provide optimal care. Nurses are responsible for the care of their patients receive and are independently accountable for the actions they take when providing or delegating care. Provision 5. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. To be effective in their roles, nurses must take time to care for themselves with the same level of care they provide to others. Maintaining one's competence and integrity to personal growth are necessary. This allows the nurse to represent their worth through self-care, personal health, and integrity. Provision 6. The nurse, through individual and collective efforts, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality healthcare. The nurse must create and maintain a healthy environment in which to practice the profession. Nurses are expected to do what's right for their patients and their workplaces. Provision 7. The nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standard development, and the generation of both nursing and health policy. The nurse contributes to a growing body of knowledge and developing and implementing professional practice standards and health policy Nurses can advocate for change in their institutions' policies and lead on multiple levels. Provision 8. The nurse collaborates with other healthcare professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. Nurses have an obligation to help advance the health and human rights of patients and the public and contribute to efforts to reduce disparities. Provision 9. The profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain integrity of the profession, and integrate principles of social justice into nursing and health policy. The nurse is responsible for articulating nursing values, maintaining the integrity of the profession and its practice, and shaping social policy. Nurses navigate through many ethical challenges presented every day while providing care for their patients. This presents a unique opportunity to respect their own moral values while respecting patients' values as well. Nurses practice with commitment and loyalties extending beyond individual patient care.